Gotcha. That's it.
That's it.
Why are you here?
Dude, I'm in pain.
Gotcha.
Oh.
Home run. What brings you here, buddy?
So, back in January, I got injured while I was riding a bike, doing this thing called the Wellness cycle.
What's that?
So I have a buddy who's like a vegan fitness guy, and
Okay.
you ride a bike and then you lift 15-pound weights at the same time. And I was
No
getting
hands?
no hands on the bike, just
Obviously.
like that. I was getting
Okay.
shredded, and I hurt my leg because I was actually working out while I was just going hard. And I went the next day to the gym, and I felt pain in my leg here, and I just thought I had leg pain, so I was like stretching it, and it was hurting so bad, just not helping. And so I went to pick up 40-pound weights, and I lifted, and I just heard like and I literally like walked home like all crooked, like this.
You heard one or two times?
Like, honestly, like, I felt like two, honestly. But it was horrible pain. Like, I laid down that day and I woke up the next day thinking I'd feel better and shake it off. And I went to get up and I was like, whoa. And I, like, had to move like that, you know?
Okay.
So,
This was January, though.
late January. And I didn't go to get MRI until I went to an urgent care clinic to be like, yo, what's going on? My leg hurts, my back kind of hurts.
Okay.
And he was like, you need to go get an MRI. So I went to get an MRI. And when I did that, it revealed that I had, well, the report said I had 2 slip discs and spinal stenosis and degenerative disc disease. And they prescribed me like drugs and stuff, but I don't take pills. Like, I don't take any.
How old?
I'm 23. Yeah.
23 with 2 slip discs and degenerated disc.
Yeah. And I run
Okay.
every day. Like, I used to run every day of my life and like very active. I
Okay.
travel like around the world all the time. So this like really threw me off. I just didn't know how to deal with it, and I went to see a couple other chiropractors that just didn't really do it for me. I did stim therapy.
Okay.
That helped me out. There's a really cool guy.
Gave you
who
some
did it.
pain relief, right?
Really, a lot of. He corrected me. I was walking like this. When I went to him, I was able to walk like this.
Good, okay.
But the main root of the pain in this area, shooting down my leg, just doesn't
stops
get away.
at the knee or goes to the toe?
It goes down here sometimes, not really my toe.
Okay.
But if it's really sore, it'll go down here if I'm standing too long or if I lean back too much. But when I'm walking, I walk literally like tilted so my body doesn't feel that pain. It's hard to explain.
Let's rewind though.
Okay.
You're telling me January. This isn't January. These are
I know.
old injuries.
Yeah.
So we need to go back to that original tailbone injury and right hip. So there's 2 good misalignments in the low back. That's in your foundation that started the process that allowed those 2 things, discs that were revealed. I don't see those 2 are your issue, your cause though, okay?
Okay.
We're gonna hunt it today.
Yeah.
And it should make sense today what's going on.
Okay.
All right. January it happened. I'll get back to that. January it happened. You went to urgent care.
Yeah, they told me I should go to see a chiropractor, and he recommended I go to this place in West Hollywood.
Okay.
And I went, and they did like they did an x-ray there, and then they put me on a machine that pulls me apart, like pulls me from my hips and up, and then also
Like traction. They were doing traction.
yeah, and then he did some adjustments to me, but every time I went, he did like the same adjustments that didn't have anything to do with this.
Hold on. Were you told what your problem is? Because here, I'm not defending or anything.
Yeah.
I've had sciatica cases come from the neck.
Yeah.
I've had hip issues come from the neck.
They never told me.
So that's number 1 is were you told exactly what your issue is?
I knew what the MRI said, and I read it and researched what it was so I could figure it out, but when I saw them, they never like would explain it to me.
Okay, did you show them the MRI?
Yeah, I had the MRI for them.
And what was explained about the MRI?
They explained that they literally just explained what treatment I should do, and then I said, well, what is the actual injury I have, and how do I get better from what is the root of the problem,
Okay.
And they never really could tell me that other than they just say disc bulge, because that was the first recommendation I got, and I was like, wait, these guys don't seem like what they're doing is right. And then they kept sending me emails like, come in to get your antibody testing for coronavirus, and like, I don't know. It just seems like they weren't really focused on like that specifically.
No. Let's leave them all out of the office now. And let's get on.
Sounds good with
Okay,
me.
so now let's rewind.
Alright.
Do you remember, you skate?
No.
Bike, skate? Activities as a kid?
I'll be straight up with you. I'm very active. I do backflips on flat ground. I climb like mountains in Hawaii. I do crazy shit all the time.
Where do I know you from? I'm still trying to figure
I don't know.
it out.
You may have seen my face somewhere. I'm not gonna lie.
I've seen it somewhere.
But I do a lot of wild stuff with my friends and just adventuring, because like my career has to do with like filming epic stuff and then marketing that for brands or
Awesome.
you know,
Cool.
et cetera, et cetera. But
Well, let's try to make this epic for you.
that's all I'm here for, man.
All right, dude. Okay, so here's what we're gonna do. I'm gonna watch you walk.
Okay.
After the walk, we're gonna go over your x-rays. I need to explain all this stuff first.
Okay.
Then from there, we'll do the exam, right? And figure out where we're gonna start.
Sounds
I
good.
do ask for 4 visits though.
I'm down.
That's it.
Yeah.
And in those 4, we figure it out. Anything above and beyond that, we'll decide at the end. You tell me what you want after that.
Sounds good.
Fair enough?
Yep.
Let's get rocking. Okay, this is your walk?
Yeah.
Okay, keep walking. So right external foot flare, he kind of does he's got the wiggle, the side wiggle going sideways. So when we're looking, I need to mark your dimples if you don't mind on the back. So, I can see. So I've been talking about the dimples. These are the PSISs right here and right here. Now, go ahead and walk. We're watching these dimples. They should move up and down when he walks, not side to side. They go up and down, but not a lot. So he's very guarded.
And also when I'm walking, I usually am like preserved with my back and curved. Like when I usually stand straight, don't make fun of me.
No, you're
I have to do it with my hand right now because I can't with my own strength.
Yeah.
This is how I walk into a room, like normally, you know, like
That's how you should.
with a good presence. But I've been like this with like my butt clenched, walking like that to relieve the pain.
So what you've been doing, just so we can talk about it, and it'll all make sense. You're doing an anterior pelvic tilt.
Exactly, all
right?
the time. Yeah.
Like this. Sorry. Posterior pelvic tilt.
Posterior, yeah.
Clenching the butt. I'm going through your position right now, and this sucks. It's not fun.
Yeah.
So this is him, and now when he's walking like, I don't want to make fun, but
Dude, I know. It sucks.
this is the walk, okay? And we'll explain why. Okay, let's walk. Keep walking.
Okay.
So it's just a very guarded walk. Do you normally swing your arms though when you walk? Normally you swing your arms, right?
Yeah, my arm's like stuck like this when I walk.
That's what, right now it is.
Yeah, like it seems like it just like stays there. It doesn't sway anymore.
Correct. But we're designed to swing the arms, okay? So yeah, he's got the waddle. We got a little movement in the dimple, then we got the side shift to the left. Right side is stuck high up, causing that external foot flare. He's got ASIN, external foot flare. And then he's just trying to follow through with that left foot, correct?
Yeah, pretty much.
Yeah.
And while I'm walking, I just feel the pain down here the whole time.
All the way down the side, the back side.
The worst is when I'm not gonna do it, but when I rotate and try to reach for something, brother, that is not it. Like when I get out of the shower, try to grab my towel or something and like turn too much, like I'll just get stuck here with shooting pain and I like can't move.
Come over here. My hand is here now. March in place, knees up high, sir. Okay, I'm gonna have you close your eyes in a second and see where you go. Close your eyes and let's see. This is really interesting. You like that? See, you got me using that word today. I don't like it. Stop. Okay, here's what typically happens.
Okay.
When I have someone close their eyes, they typically go forward from upper cervical and pelvis. You're the first guy who went backwards.
Weird.
Okay? No, it's just a different finding. Let's try it again. Just make sure I'm not.
Okay.
March in place, knees up high. So typically when I've done this, they go forward. Now, close your eyes. He's coming back to me. I don't have the answer just yet for that, okay, sir?
Okay.
But it's a different finding than what I've seen historically.
Okay.
Okay, come back over here, have a seat. Now, before we start the exam, Blake, is there anything else I need to know?
I had ACL surgery.
Okay, what other surgeries besides that?
I had a septorhinoplasty.
When did you have ACL?
ACL was when I was 18. I had my ACL and MCL. That's the scar right there.
Yep.
It's a little cross, because I actually got a scar there when I was younger.
Not the
than I did
meniscus,
surgery.
right?
Well, ACL, MCL, and meniscus.
So the triad of O'Donoghue, they call
Yeah.
it, yeah.
I had a septoplasty and then a rhinoplasty.
Sinus issues, breathing issues?
I have a deviated septum.
You do.
And it's bad in here, but it doesn't look bad.
Here. Why are you here?
Dude, I'm in pain. Like,
Come
honestly,
on.
I stress myself out so much and work so hard all the time. Like, I always have so much tension. Like, I'm just on a laptop doing this, running miles, or doing something just insane, like jumping out of a plane. Literally.
What have you been doing the last 6 months with this?
Nothing.
Just the
I
computer?
can't do anything.
So you're
and
not doing the computer either?
I can barely do the
So
computer.
you're not creating any content either?
Barely.
Either.
Like, I can barely create content. I am, because I need to stay afloat, but it's just like,
Okay.
it's dragging me down. So,
Let's get that content up.
yeah, I need
Alright.
to get back to it.
Let's do it. You have an open disc in the back on 4 and 5. That is worse than having it closed in the back, which is typical with a herniated disc. Follow my process. So in the functional spinal unit, we have the bone, the disc, the bone. 2 parts of the disc, the nucleus, that's the pivot, the ball bearing. This is the annulus that holds the pivot. The function of the pivot is to do what? 6 degrees of motion. We misalign, lose 1 or all 6 degrees of motion. But here's what I need you to see. 4, 5, lumbar spine. Look at the mechanics. There's only 1 to 2 degrees of rotation there.
Yeah.
The way it misaligns first is posterior. If it goes off the nucleus, it's typically going to go down. Yours went up. That's more severe.
That's probably because I was lifting the weights like this when I went up.
And you curved back.
Exactly.
Yes, but I'm trying to show you something. You have an open disc at the back. Your MRI shows it closed. This is 4, this is 5. I'm pointing this out for a very specific reason. Open. Whenever we have a disc open in the back, this is your answer now. And this is in the Gonstead work, guys. You guys know this, the difference between a BP sacrum and a fifth lumbar retrolisthesis. My Gonstead guys know this. When the vertebrae misaligns on L5 back and down, retro, the fix is L5. When it's open in the back, you got to bring the vertebrae below up. It's not L4, L5. Your answer is S1, S2.
That's where the pain's coming from in my leg, huh?
Correct. Okay?
Oh.
Follow my process. So while this shows, look, good signal intensity of your disc, low signal intensity because there's no movement. Global motion, intersegmental motion. Every bone has been quantified to move a certain amount. Intersegmental motion, global motion is I'm moving my whole spine. Okay. If one segment gets stuck, or even 2, 3, 4, 5 segments become hypermobile to compensate. The stuck segment doesn't move. The hypermobile segments move. Going backwards because they're hypermobile.
So this being open right here, is that making this all squished up?
Well, that's also open in the back.
Really?
They're both open in the back.
What is that right there?
That's an old tailbone injury.
That is, isn't it?
Yeah, so the sacrum has 5 segments that ossify at 32, so here's your good news. You're how old again?
23. I'm super healthy too, I really am.
So you have a potential to remodel.
Okay.
Okay, that's the point.
That's good.
That's the
the
point.
news I need
That's
today,
the
brother.
point.
That's the news. There we
S1, S2, 3, 4, 5, coccyx. S2, possibly S3.
Okay.
All right, now you want the rest of the good news?
Sure.
Okay. The rest of you, then they probably told you got some degen. I'm trying to show you something.
Yeah, he did.
This is circles, circles, circles. It's not degeneration, dude. It's because of the tilting, the twisting. You're you're looking at the bone like this.
Yeah.
You see how I've marked it down there? I've been doing that for 20 years. 8, all twisted, twisted. Those are your fun dives. This is your digestion. 6. That's all your digestion, fun stuff, undigested food. 5, 4, 3, 2, good, 1, good. 7, your discs are fantastic. And if I just did this, here's the best news for you. You have a textbook neck, my brother.
Really?
It's just forward.
That's all he told me. He said my neck is forward, so I should go like this.
But your neck is textbook. It just needs to be behind, on top of the foundation.
Yeah.
But the curve is good.
Okay.
That's your blessing. That's the good news. Your
Nice.
discs are good in your low back. You have some stuff in here. I'm not worried about it.
Okay.
Okay? Now, TMJ, right TMJ. Am I boring you yet?
No, not at all. This
All
is
right.
all stuff I wanted to learn.
So, as you open your jaw, it should be right side goes down, left side compensates the other way to bring it back midline. All of this, though, could be secondary to something in your upper cervical,
Okay.
but we won't know until I actually check you.
Gotcha.
So, put it together. Foundation, rotated sacrum, pelvis. We're not starting there. I don't see it yet. We're probably starting somewhere here. Let's see what we find. I probably wouldn't touch this area. I would be okay doing down here and anything above T9.
Okay, yeah, because this area is super sore all the time. And honestly, I'm usually like really lean and like when I like even like take a photo or something, like I'm lean here, it's like super swollen back here on both sides. So I'm guessing that's a result of what's going on.
Does that make sense?
That makes perfect sense. Thanks for explaining it in detail.
Yeah. So even sitting, you can see, but I cannot get extension. Sit whatever's normal, comfortable for you right now. Okay. So from here, you can see this block right there. And this block, we need to get that curve. Okay.
Yeah, this is how I used to walk.
Okay, we need to get that curve in. So sit whatever's comfortable and let's run the meter. Just feeling overall body temperature. You can see creases higher there from the pelvic misalignment, lower here. Dimple is higher on the right than the left. Starting at the base of the neck. And the first thing we're getting is 18 points, C1, left side. This is a temperature differential. It's measuring temperature left to right side and giving us the absolute, okay?
Mm-hmm.
Needle sticking all the way left side, all the way down to, interesting, let's do that again. So it looked like it was gonna break here at around T9, but it didn't break. It just swung and continued. Oh, there it is. You're the stomach sleeper, you said, right?
Yeah, I sleep on my side and my stomach with like my left leg hiked up on a pillow.
Okay, so I'm getting the T12 area. T9, this looks like compensation in this area here, but this, so it's kind of just doing this right now. And then
Yeah.
it stops right there.
It's like a sneak.
Correct. Okay. Right side. Now here's what's going to be interesting. I'm going to do this 4 or 5 times. The needle's going to shift to the left. Watch. There it is. S2, left side. That's so crazy. Yep, S2, even S3. Starting right there, sir. S2, S3, around T12, L1, and C1. 1, 2, 3. Now let's go ahead and check your pelvis. Scoot forward for me, please, sir. You're a little acidic, okay? Running the meter, I'm getting a lot of red tracks on your spine. When I see that, we call it the hyperemic response. It's red from either dehydration, you need more water, or you're a little acidic. Okay, feet together, open and close the knees, please. Open and close. Open, close. A little faster, sir. Thank you. Right side only. Good. Left side only. Yeah, so when he does the left, the whole right wants to shift with him. When he does the right side only, the left is independent. To the right side, please. There's a little pull of the muscle, but that's fine. Sit back for me, sir. All the way back. Okay, let's start down here. So this is your L5.
Okay.
Tender.
Yeah.
That's your L4. I know it's tender. That's L5. Tender. Now let's go down. S1. Sharp, right?
Yeah.
S2.
Ooh, dude. Ooh, that was sharp.
All right. S3. One more.
Oh, okay.
Okay. What more can I say?
Ooh.
S3. One more, sir. Not as bad as S4. Starts at.
Oh, wow.
Sorry, brother, but
it's
I
all good.
have to show you.
Good,
Okay. Where is it starting?
S3.
Thank you.
Yeah, for sure.
For sure. Okay, head down, sir. Round your back. Round it for me. No, you can't even do it. It's fine. Static palpation, running my fingers down the spine. So you can see right there is the orange peel. That's the swelling and edema right there. That's 5, 4, 3, 2, 1. That's 12. You do feel that, right? Okay. T12, S3. And let's check the neck. Scoot back for me, please. I need to grab a little bit of the hair. That's C6. 5, 4, 3, 2.
Ooh.
Head down slow, please. That's all coming from there. See. I want you to explain. I want to know. I want to hear what you got out of it.
Okay, I will.
So I want to know what you got out of it. So what did you get out of our exam and findings?
What I got out of the exam is that the foundation is messed up from the sacrum and the pelvis.
Yes.
And it's an anterior on the right side, right?
Pelvis is anterior.
Pelvis anterior, and then the sacrum is
rotated.
rotated.
Side, yeah.
And that's causing pain to the sciatica root, which is giving me all that pain. And then basically the rest of my body is compensating for that misalignment, I guess for lack of a better term, from the sacrum and the pelvis. So I literally am like walking around with like a swiney back.
But here's the other part. Where did we find the major pressure? Was it L4, L5?
No, the pressure, remember, like I have the disc slip at L4-5, but all the pain's coming from S3, which is sacrum.
S3, sacral.
Yeah, and I have a previous tailbone. My tailbone's supposed to go like that, and it just goes like that.
So instead of a curve, he's got a hard.
That's why you guys been saying I've been walking like that.
So he'd be walking like this, right?
Yeah. Oh yeah.
That's him, right?
Yeah.
All right. You can handle it, right?
Sure, let's
Do
try.
you want me to be nice now or do my job?
Get the job done, yeah.
All right. We're gonna start.
It's so tender in my leg and my butt cheek though around here. I'm just letting you know.
I understand. Now, I'm gonna do the left atlas first. I'm
Okay.
gonna have you walk after that. You're gonna tell me what's different from just the neck adjustment.
Okay.
And then we'll continue. Okay?
Mhm.
Left hand up, time to get the seatbelt on. Left hand up. You did see this on the vid, right?
No, I didn't.
That's a good thing your friends there. Jokes. This is to stabilize the upper torso, makes the adjustment more specific, less twist, less rattle. Okay, nice and light. Feet out, resting on your heels. Feet out all the way. Straighten your legs out on the heels, palms up. There you go, resting on your thighs. Good. Okay. And the low back is the last thing I'm gonna do, because once we do that, we don't want you sitting. Gotcha. Give that a second. Take in a couple of
Oh my God.
Give me a couple of nice deep breaths.
I feel like I'm in a different body here up. Like a different head.
Stand up and walk. Let's see what's different just from that. Tell me what's different just from that. Still have work to do.
Wow. It honestly feels like, you know when you have a rusty chain on a bike and you throw WD-40 on it?
Yeah.
Oh, dude, I'm flowing.
Alright, good. Let's go left side down.
This is awesome.
Left side down, sir. Slide your whole body forward. I'm starting it here, Blake. You've seen me do this.
Yeah.
You're not ready for that.
Okay.
Okay? I'm not going to be that mean. Nice and easy. Now, I'll get you in position. It's
Okay.
going to be quick. I'm not twisting you.
Okay.
Head down. I'll get you in position. I'll tell you before I do anything, okay?
Mm-hmm.
Tuck forward. Forward. Full body forward.
Oh.
Whoa. Okay.
Okay, hold on.
No problem. You take your time.
Okay.
You tell me you're ready.
I'm ready.
Okay. Let's do
Am I
it.
tucked forward enough?
You're good.
Okay.
You okay there?
Yeah.
Okay. It's got to be quick, guys. Quick. This is not about brutal force, okay? 1, 2. That's 3. Gonna get the cobra. You're gonna get the cobra. That's 3. Okay. Is that good there?
Yeah.
Breathe. You're thinking way too much. Close your eyes for me, sir.
Okay.
Happy space, please. Happy space, brother. I will need to push this up. Are you okay with that?
Yeah.
Shoulders okay? Gotcha.
Oh.
Home run. Come look at him. Look at his face.
He said home run. I love
That's
it.
the home run.
Can I get up?
Not yet. Give it a second.
Okay.
You okay? Push
Yeah.
yourself up. Push yourself up. Swing your legs down. Dr. Gonstead used to say, get up like a cow, not a horse.
Okay.
Stand up and walk. Check it out. Good stuff.
I feel like I'm walking with my foot more forward.
I'm not saying nothing right now. I'm just letting you walk. I'm just letting you walk. 3 more times. Yeah, dude, you're not twisted on that right foot as much.
Yeah, I'm not.
And we didn't touch the pelvis yet. It's gonna feel weird, but here's the cool part. Guess what you get to do today?
What's that?
You get to buy some new shoes if you don't have a pair of new ones. New shoes? Why? We're changing alignment. Don't wear the same tires.
Okay.
All right, keep walking,
Yeah.
please.
Copping some Yeezys, Bryce.
Yeah. My nephew just sent me some white ones, so I think I'll start wearing them.
Maybe
Might as
twins
well.
next time.
Might as well. Walk one more time and then have a seat and we'll retest everything.
Okay.
Should feel different in your walk.
It feels drastically different, honestly. Like, I'm not just saying that.
Well, you're actually swinging a little bit of your arms without even mentioning it.
That's why I feel good. Like, I can do this. I'm not walking like this.
Right?
So,
Come over here, have a seat. Let's retest everything. Sit up straight. Check this out. Good. So that block is already half. Remember that block? Go into extension, sit up straight. That's fine. Now sit, stand up, and then just sit whatever's most comfortable. Cool. Neck is 0. T12 is clear. Didn't have to touch it. Cool. Everything S3 is 0. Check this out. Back slowly towards me. This is 5. Okay.
I haven't done that in months. I'm serious. I have not leaned my back like that in months.
S1. Check it out.
Oh my gosh.
S2. Check it out. Keep going, dude. You got it. You got it. You got it. That's
Okay.
it. S3 is the scream, though, right?
Yeah.
Tell me.
Okay, I feel it there.
Okay. No problem. But definitely a lot more extension, yes?
100%.
Okay. Right side. How's the twist? Give me a high five back here. Give me a high five back here. Well, you said this was an issue, right?
Yeah, it was.
Grab this here.
Okay.
Any twinging in the back?
No.
Okay, grab it on this side.
Nothing at all.
Nice. Okay, I'll take that. Can I continue?
Yeah.
Ears.
Yes, those are my ears.
Shoulders.
Whoa.
Shoulders. On your back.
Crazy, dude.
Time for your feet. On your back here, sir.
On my back?
On your back.
I didn't know your ears could get adjusted.
Yes. Now, keep one
That's
knee
great.
bent, okay? Keep
All right.
one knee bent, straighten your right leg.
Okay.
Okay. Now, I'm using the board just to get the ankles moving.
Okay, this is super.
I got it. How about here?
No.
That's it. Bend the knee.
Okay.
Sit up for me. Let's do a buff and polish. Let's get rolling. Okay. Now the fun part.
All right.
Oh man. Whatever you can handle. If you can't handle it, raise
that
your hand.
feels-
I'll stop.
That feels so good.
Walk it off one last time, sir. That's where we're going to start for today, and I'm going to do your hands.
Okay. I am not stiff.
Watch his walk too. His legs are straight.
I'm not stiff. I don't feel like my leg has to go out anymore. And overall, I just am like flowing.
Not shake. Squeeze.
Just doing squeeze hard.
Do whatever you want. Squeeze.
Okay.
That's it. Squeeze. We have a radial head and humerus. Squeeze hard. I'm checking all the bones.
Okay.
Squeeze. Here we have an ulna. Straight. Straight. There. Posterior humerus. Posterior radius. And loading. Squeeze hard. Squeeze hard. Not shake.
Alright.
So this,
My bad,
just
my bad,
this,
my bad, my
and
bad.
squeeze.
Okay.
Squeeze. Thank you. Squeeze. Solid. On your back. The grand finale. Chin down, sir. Chin down all the way. Look down. Down. I'm going to grab the nostrils like this. I'm going to pull them over, and I'm just here on the septum, light. That's the move. That's it. Gotcha. Walk it off. Look at his back, the swelling is half gone already.
Dude, I feel great. Really cool.
Okay. That's where I'm gonna start with you, sir. any change in the breath?
Yeah, I'm breathing more clearly.
Questions?
Nah, dude, thank you so much. Seriously.
Welcome to the
Thank you.
I'll see you in a couple of days.
Sounds good.
Okay?